because of the coronavirus pandemic. It
Mhm.
certainly changed a lot. Do you have any thoughts about that, Marcus?
I think there's been a lot of conversation about this belief that COVID somehow it did that it was transformative in the sense of that it changed the game. I actually don't think it changed anything. I think what the COVID pandemic and our response systemically, COVID was more of an accelerant, meaning there were already these things that were occurring, and what it did is it just put rocket fuel. And I think one of them is in this movement into I think what I call is an emerging omni-channel reality in health and healthcare. And what I mean by that is I think there's a little too much probably noise at the moment about telehealth. And I'm not. And by the way, don't read that as I'm sort of against or anti telehealth. I just don't believe in telehealth in and of itself. I believe in telehealth solutions as part of an integrated omni-channel experience for consumers that combines more accessible care that's physical in nature, telehealth, digital health, AI-driven care, care in the home and home care, care in the community. And so I think, if anything, what it did is COVID, I think, created an accelerant to that movement into an omni-channel care environment, certainly for consumers. But I think the other thing that we're not talking a lot about here, which I think is a mistake, is it also accelerated the desire of providers and professionals to want to participate in that omni-channel environment. I think there were a lot of physicians, for example, who were skeptical of working in a telehealth environment or working in a digital environment, or and then got exposed, and now all of a sudden they themselves are more convinced. You're seeing a lot of these providers and professionals raise their hand and say, I want to now be part of this new omni-channel experience that we can create for patients, for consumers. And so I think that's probably what it did, is it's just accelerated the, our belief of what is possible, and taking something that might have been 5 or 7 years out and saying, no, now it might be 2 or 3 years out. It's kind of moved the top of the mountain a lot closer to us.